All right, let's jump right in. If you're a physician who's been trying to use AI, you've probably felt that pang of frustration, right? You ask a question and get back something so generic it's completely useless. Well, today we are moving past that. We're going to break down a framework built specifically for us, for medicine, to get clinically useful results every single time.
In this quote, it really hits the nail on the head. We're talking about a huge shift, away from just, throwing random questions at a chatbot and hoping for the best. The whole point here is to build a reliable, repeatable system that gives you professional-grade results you can actually trust.
And this slide just illustrates the problem perfectly. I mean, look at this. On the left, a super generic prompt like, explain diabetes. And what do you get? A vague Wikipedia-style answer that helps absolutely no one in a clinical setting. But on the right, a prompt that is packed with specific clinical detail. The difference in the quality of the output is it's night and day.
So here's the crucial thing to remember. When you get a bad result, it's almost never the AI's fault. It's an incredibly powerful tool, but it has no context. It doesn't know you're a cardiologist. It doesn't know if your patient is 8 years old or 80. The quality of what you get out is a direct reflection of the quality of what you put in.
And that's exactly why those generic prompting frameworks you see online just don't work for us. They don't account for things like HIPAA or clinical nuance or our standards of care. So let's get to the solution, a method that was built from the ground up for physicians.
This is the clinical framework. Now, I want you to think of this not just as a list of tips, but as a reliable system. It's a step-by-step method designed to make sure your prompts are structured in a way that generates outputs you can actually use in your practice right away.
The acronym itself covers 8 key parts of what makes a perfect medical prompt. We've got context, language, integration, nuance, iteration, compliance, adaptability, and building long-term systems. I know it seems like a lot, but each one plays a vital role.
Now, going through all 8 of those would take a while. So for this explainer, we're going to zero in on 3 of the most critical, high-impact components. These are the ones that will get you started on the right foot immediately.
First up, C is for context. And honestly, this is probably the single most important element of all. The AI knows nothing about your patient, your specialty, or the situation unless you tell it. Context shapes everything: the tone, the depth, and the medical terminology of the response.
Just look at how tangible the difference is here. On the left, we've got a total shot in the dark, right about hypertension. Useless. But now, look at the prompt on the right. See how it specifies your role as a family physician, the patient's age and condition, her anxiety about starting meds, and even the need for a 6th grade reading level. That is context, and that's what gets you a useful result.
Okay, next, let's talk about L for language precision. It's pretty simple. Vague language gets you vague outputs. In medicine, precision is everything, right? The same thing applies to your prompts. You have to use specific medical terms and be crystal clear about the required language level for the output.
And this slide is the perfect example. On the left, the phrase heart problems. I mean, that's so vague it could mean 100 different things. But check out the prompt on the right. It gives precise details: coronary artery disease, history of a specific stent placement, current medications with the exact dosages. This level of detail is what ensures the AI's response is clinically accurate and truly relevant. The final piece we're going to highlight is the second C, and that's for compliance and safety. And this part is absolutely non-negotiable. You are always legally and ethically responsible for what you document or communicate, even if an AI helped you draft it. And never, ever input patient-identifiable information into public AI tools. So the bottom line is this: AI output is a first draft. It is never a final product. Your workflow must always be review the AI's draft, verify its clinical accuracy against current guidelines, edit it with your own professional judgment, and only then you approve it for use. This is our professional responsibility.
Okay, so you've learned how to craft a fantastic individual prompt, but the real power, the real time savings, comes from turning this skill into a system. Let's talk about how you can build something that saves you time over and over again.
This is really the key takeaway for long-term efficiency. I mean, crafting a great prompt from scratch every single time is better than nothing, but saving and reusing your best prompts, that's where you unlock massive time savings. You're essentially building your own personal library of assets.
And building this library is actually pretty straightforward. First, just identify your most repetitive tasks. Things like writing patient education handouts for new diabetics or drafting appeal letters for insurance denials. Second, you craft that perfect clinical prompt for each task.
Third, you test and refine it over a few uses. And finally, you save it somewhere you can grab it in seconds.
So as we start to wrap up, let's tie this all back to the ultimate goal. Adopting a systematic approach to prompting doesn't just improve your outputs, it fundamentally changes your workflow and gives you back your most valuable resource, your time.
What does this number mean? 360. It's not a lab value, it's not a dose. It's a measure of time.
360 hours. That's the average time a physician loses every single year to administrative work that a well-prompted AI can help automate. That is 9 40-hour work weeks. Mastering this skill is about reclaiming that time for your patients, for your family, and for yourself. By moving from these random attempts to a systematic framework like Clinical, you can start to chip away at those 360 hours, one great prompt at a time. The only question left is, are you ready to get your time back?